Hello everyone, in this video we will discuss about the Proseal LMA. Now the Proseal LMA is an advanced reusable second generation supraglottic airway device. It is used for controlled ventilation and as an emergency rescue device. Now what are the parts? A mask with the dual cuff. The Proseal has a dual cuff design with a perilaryngeal cuff and a distal tip cuff which provides a high airway seal pressure. It is made up of medical grade silicone. Then we have the airway tube. The smaller one is the airway tube. It is wire reinforced to prevent collapse or kinking, and it terminates into a 15mm standard connector. This one. Then we have a drain tube. This longer one is the drain tube. It is a parallel channel that passes through the mask tip to lie opposite, here is the opening, it lies opposite the upper esophageal sphincter, allowing for gastric tube placement or passive venting. This is the inflation system. It has an inflation line, a pilot balloon and a one-way valve for cuff pressure monitoring. This part is also made up of medical grade silicone. Then the integrated bite block. This is built-in reinforcement to prevent accidental occlusion by the patient's teeth. Now the Proseal LMA comes in various sizes, right from 1.5 to size 5. 1.5 is in infants for 5 to 10 kg. And the maximum amount of air that is used to inflate the cuff is 7 ml and the gastric tube that can pass is 10 French. Size 2 is for children 10 to 20 kg, 10 ml air and 10 French gastric tube size. 2.5 in children 20 to 30 kg weights, 14 ml air and 10 French gastric tube size. 3 size is for small adults 30 to 50 kg, 20 ml air and 14 French is the gastric tube size. 4 is medium size adults 15 to 70 kg, 30 ml is the air and 14 French is the gastric tube. 5 is for large adults 70 to 100 kg, 40 ml is the air that can pass through to inflate the cuff and 14 French is the gastric tube size. We have to remember that always maintain the intra-cuff pressure at or below 60 centimeters of water to minimize the risk of mucosal trauma. Now what are the indications? Indications of Proseal LMA is routine airway management for elective general anesthesia cases, as an alternative to LMA classic when a higher seal pressure is required, and a rescue airway in cannot intubate, cannot ventilate scenarios. What are the contraindications? Contraindications are a full stomach or a high risk of aspiration, esophageal or pharyngeal pathology or trauma, severe trismus, mouth opening less than 2 centimeters, and decreased lung compliance requiring pressures more than 30 centimeters of water. Now how to clean this Proseal LMA? After use we have to thoroughly clean under running water. We have to soak it in an enzymatic detergent. Then after that, clean the airway tube and cuff and the drain tube with water and inspect for any cuts or punctures. Then we have to deflate the cuff. Now how do we sterilize it? Sterilization is by using steam autoclaving, and the typical cycle is 134 degrees Celsius for 3 to 4 minutes. Thank you and subscribe to the channel for more anesthesia pearls.